This week on Maternity Matters, Channel 5, an 18-year-old Indo-Canadian woman with her first child. She's at 33 weeks gestation and she's 175 pounds pre-pregnancy weight. Now, it looks like her initial blood pressure was 110/70. We're gonna go take a look at what happened at this week's visit.
Hello Diane, my name is Michaela. I'm a student nurse and I'm just here to do a head-to-toe assessment on you and see where you're at in your pregnancy.
Okay, what are you going to assess?
I'm going to just do your blood pressure, your vitals, and I'm going to do a urine test and a head-to-toe assessment with my stethoscope.
Okay.
Can we start by doing a blood pressure?
Yes.
Alright. So Diane, your blood pressure is 142/92, which is higher than your blood pressure pre-pregnancy. Your other vitals are within normal ranges and you currently weigh 207 pounds.
So how much have I gained since my last appointment?
Your last appointment was 2 weeks ago and you've gained 4 pounds since then. But I've also noticed some minor swelling in your legs and a moderate amount of protein in your urine.
Is that bad?
These results are indicative of preeclampsia.
Is that like high blood pressure or something?
Well, ladies and gentlemen, let's go back to the experts. Okay, I'm just here with Dr. W, and I was just wondering if you could give us the medical diagnosis for your patient Diane.
Diane's been diagnosed with mild preeclampsia and she's been sent home on bed rest.
Awesome. Let's go back to the assessment room to see what happens next.
So I have high blood pressure?
Yes, so preeclampsia is high blood pressure and protein in your urine. So I'm just going to go get a pamphlet and then we can go over it together and we'll discuss what happens when you're on bed rest. How's that? Alright, so here's the pamphlet. So first of all, when you're on bed rest, you want to make sure that you are maintaining the 8 to 10 glasses of water that you should be drinking every day. You want to record your daily weight, record the number of fetal movements, limit physical activity, make sure that you pee because that'll help decrease your blood pressure. I will give you some urine dipsticks so that you can check your protein. So lastly, I'll give you a blood pressure machine to check your blood pressure twice a day.
And so what am I looking out for?
So you want to contact your healthcare provider, Dr. White, if you see an increase in your blood pressure from your baseline, which was today it was 142/92. So if you see an increase from that, you want to be calling her. Also, if you see an increase in protein in your urine, if you're gaining more than a pound a week, if you're peeing a lot, if you see or notice that you have a decrease in fetal movement, so if your baby's not moving quite as much as it usually is, if you notice any headaches or dizziness or visual disturbances, if you see that you have more swelling in your feet, hands, or face, because face is not a common one that you would think, but it does happen.
Okay.
And if you have stomach or back pain, nausea or vomiting, or excessive heartburn.
So what should I be looking for?
So you want to be contacting your healthcare provider, Dr. White, if you notice an increase in your blood pressure. So today your blood pressure was 142/92. So if it's increased above that, then call Dr. White. Also, if you have an increase in protein in your urine, if you're gaining more than 1 pound in a week, if you're peeing a lot, if you've noticed a decrease in movement of your baby, if you have headaches, dizziness, or visual disturbances, if you notice more swelling in your hands, feet, or your face, if you have stomach or back pain, if you have nausea or vomiting, or excessive heartburn. I know that it's a lot to handle, so I'll give you this pamphlet.
Okay.
You can take that home so that you can remember. Okay. Is there something else bothering you, Diane?
Well, I had a one-night stand and that's how I got pregnant and now my family won't talk to me.
Oh, honey, do you want to talk about it?
What a pickle. What do you think, Dr. W?
Well, I think at this point in time we need to take a look and see what types of supports that Diane has at home, if she has any friends that can help her out, maybe there's some community resources that can help her out. We're just going to have to do some digging.
Yes, and at this point we would like to go back to you, yes you, the class, to discuss what are some possible questions to ask Diane at this point. Great participation, class. You guys are all brilliant. Now, Diane is sent home with mild preeclampsia with orders of bed rest. Let's go see what Nurse Michaela has to say before she gets sent home.
Alright, Diane, so you should rest on your left side as much as possible because this increases the blood flow to your placenta, it'll decrease your blood pressure, and it will help you pee. So your visits here will be more frequent, and we'll do more frequent blood work, and remember to take your blood pressure when you're at home every 6 hours while you're awake, and record just the increased readings.
Do I need to change my diet at all?
Just eat a well-balanced nutritional diet. So you just want to include high protein foods. There's no need to restrict your sodium. And if you have any concerns and if we're worried about how you're doing at home, you might be admitted to the hospital so we can monitor you more closely.
Okay,
All right, I'll help you get out of bed.
thank you.
You're welcome. See you later.
It's been 4 weeks. Diane's at 37 weeks gestation now, and she's been admitted to labor and delivery room for induction of labor. Oh my goodness. This in. Her blood pressure this time is 165 over 100, and her pulse is 88 beats per minute. Let's go see how her assessment goes. I'm here.
Diane, so I've done your head-to-toe assessment and I've done a urine test. You have a moderate amount of swelling in your feet and you have a moderate amount of protein in your urine. So that's more than your last visit. So now I'm just going to assess your deep tendon reflexes for any involuntary contractions in your knee or your ankle. Is that okay?
Mm-hmm.
Okay, can you just lie down for me and then we'll take the blanket off. Okay, so I'm just going to support just right under your knee and hold the tendon that's on your knee, and then I'll give you a tap. Okay, ready? 1, 2, 3. Okay, and now I'm going to move on to your ankle and check if you have a natural movement on your ankle. So I'm just gonna lift up your foot here while supporting your knee, and then I will let go. So just relax. Okay, so that looks good. So we would classify that as a +2 on the deep tendon reflexes scale. So that's just normal. So what we're testing for there is if you have high levels of magnesium sulfate in your blood, which it appears as if you do not. So Diane, are you having any other concerns today?
Well,
Sorry, I'll let you sit up.
I was fine until a couple days ago, and then I noticed some swelling in my hands and my feet and my face. And I also have a headache up here, and Tylenol's not helping it.
Okay, so you've taken Tylenol. Headaches are very common in preeclampsia, especially right at the front or the back of your head. So I'm going to continue with your head-to-toe assessment, and I'm going to do a vaginal exam to see if your cervix is dilated, okay?
Okay.
Okay, just have a lie down again.
Upon assessment, the nurse determines that Diane is dilated 2 centimeters and is effaced 40%. Her cervix is firm, her membranes are intact, and the babe is in anterior position of the cervix and is at -2 station.
Where do we start? Okay.
Okay. 1, 2. Okay. Hi Diane, how are you doing?
I'm alright, how are you?
I'm okay. So we're going to have to induce labor, okay?
Why?
Well, you have preeclampsia, and the only way to stop preeclampsia is to deliver your baby.
Is it safe?
Well, the suggested time for delivery is 37 weeks for a woman with mild preeclampsia, and you are at 37 weeks gestation, so it is appropriate it's an appropriate time to induce labor. In addition, your blood pressure has also increased since your last visit. You have more swelling in your hands and your feet, and you continue to have protein in your urine. So it's possible that you have progressed to severe preeclampsia.
So I'm here with Dr. W again, and so when we go back to Diane, the nurse does a Bishop score to determine that Diane has a score of 5. So this indicates a cervical ripening method should be used prior to induction, and this includes sex, nipple stimulation, using a Foley catheter, stripping membranes, or even using a sterile rod made of kelp. So basically the kelp absorbs moisture, swells, and causes the cervix to dilate. Since the bishop scores 5, this indicates Diane has an unfavorable cervix, right? So can you just elaborate a little bit more on the bishop score for me?
So the bishop score is a tool that we use to be able to tell if a woman is more or less likely to have a successful vaginal birth. If she scores over 8, then she's most likely to have a successful vaginal birth, and below 6, it shows that the cervical ripening isn't quite there yet and they need some help.
Excellent, excellent. All right, let's go back to the nursing assessment room and we'll see what happens next.
All right, Diane, so I've talked to Dr. White, and we will most likely be starting you on oxytocin to induce your labor today. So oxytocin is a naturally occurring hormone. It's synthetic in the hospital, but that's okay. It's naturally occurring in your body, so it stimulates uterine contractions. All right?
Okay.
All right, so are you in any pain today?
Not right now, I'm feeling pretty good.
You good right now? Okay, that's great. But we do still recommend an epidural in cases like yours with women who have preeclampsia, because we find pain a very important thing to manage in the hospital, so it'll help decrease your likelihood of getting spikes in pain. So it will also prepare you for if there's an emergency C-section. So that doesn't necessarily mean there will be an emergency C-section, but just in case. So most importantly about the epidural is that it'll prevent an increase in your blood pressure during labor, and it'll improve the blood flow to your baby.
Okay.
Okay, so just make sure that you're reporting any changes of pain to anyone in the healthcare team,
Okay.
and we'll be in to assess you just
I'll let you guys
constantly.
know.
Yeah.
Ladies and gentlemen, Diane is now in labor and her membranes have spontaneously ruptured. The nurse recognizes that a small amount of green amniotic fluid is present. The nurse also recognizes that green amniotic fluid indicates a risk of meconium aspiration syndrome, which is when the baby poops in utero and then swallows or inhales this fluid that can cause respiratory distress. Very bad. So the nurse also determines that Diane is 4 centimeters dilated, 50% effaced, vertex is at -1 station, and the nurse has followed protocol and has started oxytocin augmentation.
Get like a rip here.
Okay.
Yeah.
So why is oxytocin still needed?
So oxytocin is still being used to help your uterine.
Okay, let's just start
Good.
again. Okay. So why is oxytocin still needed?
Oxytocin is still being used to help your uterus contract. So we're aiming to have contractions every 2 to 3 minutes that last 40 to 60 seconds. So this allows your uterus to relax in between contractions.
Okay. Will it hurt my baby?
It's generally well tolerated and it doesn't cross the placenta to your baby, so there's no direct risk involved with your baby.
Is there any risks with augmentation?
Well, there are some risks. Like I said, risks. They're not guaranteed. So we'll have to maintain accurate fluid intake and output just in case you have too much fluid in your body. So there's also a risk for overactivity of the uterus, impaired blood flow to the uterus, low blood pressure, and there may be a quick labor, so that can cause damage to your cervix or uterine rupture. So we're gonna focus on your breathing right now and control the labor process, all right? All right, I'll be here with you the whole time.
Okay, I'm ready.
You ready? Good.
Well, folks, we're back here on Maternity Matters, Channel 5. We've been through a lot today. We've been through a pickle. We've been through pregnancy. That's including the induction, the augmentation, and we met great people along the way like Dr. V here. Do you have anything to add today?
Not too much, just glad that mom and baby are okay and wish them all the best.
Me too, me too. She's got a great baby. Now, Maternity Matters, Channel 5.